We have 10 neurologists right now, soon to be 11. All of the neurologists have their own specific subspecialties in various sub-areas of neurology. Mine, for instance, is movement disorders. Other subspecialties in neurology including epilepsy, stroke, neuromuscular, headache, cognitive neurology. All of these areas of neurology are becoming more and more subspecialized because the treatments are becoming more and more sophisticated. I joined in 2018. I was the 10th neurologist to join the group. At that point, we had a very long wait list for movement disorders, about 3 years or longer. And so it was identified that there was a need in Lower Mainland for another movement disorder neurologist to join the group that was already here. And so over the past 3 years, we've been working to move that waiting list down to 6 months. So 10 years ago, there were only 2 neurologists here, and they had difficulty with retention. They didn't have an official clinic, and in terms of retaining neurologists for the area, that was a difficult sell. Having an actual clinic space where neurologists can have their clinics and where patients will actually know where that is has helped with recruitment. So there are multiple avenues to being referred here. One, the family physician has identified that there is a particular neurological concern and refers to the particular neurology subspecialty clinic. 2, the person has gone to the emergency department and is identified by the emergency physician as having a problem that could be dealt with as an outpatient in a subspecialty clinic setting. Historically, the goal of a neurologist has been to diagnose the problem. Nowadays, we can actually treat a number of things. For instance, in the hyperacute setting, you might see a stroke neurologist. If you're coming in with a stroke and there's an identifiable clot, we'll give you a medication that will break up that clot, allowing blood flow to be reconstituted to the part of the brain for the stroke symptoms to be resolved. If you've got a headache, there are any number of different therapies that can better help to manage a headache once the specific headache type is identified. So more and more, we're moving to these kinds of advanced therapies. We're using kind of technological devices. Movement disorders, again, being another example where some patients with more advanced Parkinson's disease will get what's called a deep brain stimulator. And that device helps to reduce the amount of medication that the person is on and better manage their motor symptoms. Part of the push of trying to grow Fraser Health has been to develop these subspecialized clinics, have our own, not be referring out.